Welcome to our presentation on the anticholinergic drugs. This presentation was taken from the lecture of Dr. Nirbhay Kumar, an assistant professor of pharmacology from Bihar University in India. Anticholinergic drugs are also known as parasympatholytic drugs. These drugs block the muscarinic receptors only, and they are also known as the antimuscarinic agents. So basically, the anticholinergic drugs are those drugs that shut down or inhibit the parasympathetic nervous system. That is why they are also known as the parasympatholytic drugs. For the MOA of the parasympatholytic drugs, particularly the antimuscarinic agents, so under this, now we have atropine as the prototype parasympatholytic drug. Atropine and related drugs will block the cholinergic muscarinic receptors by acting as competitive antagonists of acetylcholine or other direct-acting cholinergic drugs. So take note that atropine will only block the muscarinic receptors and not the nicotinic receptors. That is why it is also known as anti-muscarinic agents. The parasympatholytic drugs, particularly the antimuscarinic agents, can be classified according to its origin and structure. So for the first classification, we have the natural agents. When we say natural agents, these are alkaloids or these are derived from plants. Under this, we have the atropine and hyoscine or scopolamine. We also have the synthetic agents. So the synthetic agents can be categorized according to their structure. The first category is a structural analog of atropine, and we also have the structurally non-related to atropine. So under this, for the structural analogs of atropine, the most commonly used are, of course, we have the atropine methyl nitrate. We also have the homatropine as well as the epratropium. We also have the homatropine. For the structurally non-related to atropine analog, we have the glycopyrrolate as the most commonly used drug. We also classify the parasympatholytic drugs according to their MOA. So for the antimuscarinic agents, they can be classified according to their selectivity to the muscarinic receptors. Of course, we have the non-selective muscarinic receptor antagonist. This includes the atropine, scopolamine, and the homatropine. We also have those that are selective muscarinic receptor antagonists. So they are selective to block the M1, for example, M1 receptor. That is why they are called M1 antagonist. M2 for the M2 antagonist. M3 receptor for the M3 antagonist, and we also have the M4 antagonist. So of course, the most commonly used antimuscarinic agents are atropine and scopolamine. So they are considered to be non-selective for the muscarinic receptors. For the pharmacological actions of the parasympatholytic drugs, so we'll start with the cardiovascular system. For the effects of the anticholinergic drugs to the heart, or particularly on the cardiovascular system, the small doses of atropine will cause an initial temporary bradycardia. So this is the initial effect of administering atropine. There is initial temporary bradycardia. This is due to the agonistic action to vagal stimulation. We also have uh, in high doses, it can cause tachycardias. Of course, atropine is indicated to prevent bradycardia, so it induces tachycardia, and of course, it mimics the action of the sympathetic nervous system. So it induces an increase in heart rate. So atropine, like drugs, antagonize the fall in blood pressure that is caused by the choline esters. For the gastrointestinal tract, so it has a spasmolytic effect on the GI smooth muscle. So when we say spasmolytic effect, this is a drug that relieves the spasm of the smooth muscles, and it prevents the effect of the endogenous acetylcholine. Of course, the effect of the endogenous acetylcholine to the GIT is to promote peristalsis, or the contraction of the GIT. It blocks the increase in tone and motility of the GIT caused by the cholinergic drugs. For ruminants, it induces a reduction in the motility of the rumen, and it also inhibits the GI secretions, including salivation. For the respiratory tract, Of course, it inhibits the bronchial secretions as well as it promotes the dilatation of the bronchi. So this is important as a temporary relief of dyspnea or difficulty in breathing, deep breathing. We also have asthma or hives in horses. So hives is a condition in horses that is similar to asthma. For the effects of the parasympatholytic drugs, the anticholinergic drugs to the eyes. So it induces mydriasis or the pupillary dilation and cycloplegia or paralysis of accommodation following local or systemic use. So the mydriasis is due to the blockade of the cholinergic influence, and cycloplegia is due to the paralysis of the ciliary muscles of the eyes. For the urinary tract, it has a spasmolytic effect on the ureters, and this is useful in the treatment of renal colic, and it is also indicated for urinary retention as it relaxes the bladder. So in man, now there is anhydrotic action, and when we say anhydrosis, it is a condition in which the sweat glands make little or no sweat. There is also a rise in the body temperature but does not prevent sweating in horses. For the CNS, scopolamine in small doses produces depression and excitement and delirium at high doses in cats and dogs. Atropine and scopolamine are again considered to be derived from plants, so they are alkaloids. Atropine is an alkaloid derived from the leaves of the belladonna plant, deadly nightshade, Chimson weed, and henbane. We also have the scopolamine. It is also an alkaloid extracted from the leaves of Hyoscyamus niger and Scopolia carniolica. For atropine poisoning, so the antidote or the reversal agent for atropine poisoning is physostigmine. So of course, physostigmine is a cholinergic agonist drug. It is an anticholinesterase drug. It is for the contraindications in animal species, so we have here rabbits. So aside from horses, horses is also a species wherein atropine is administration is contraindicated. So rabbits possess an enzyme, atropinase, which hydrolyzes atropine and thereby able to feed on deadly nightshade with freedom without showing any toxic symptoms. So rabbits is one species wherein atropine administration is not recommended. Have the term atropinization. So this describes the physical effects caused by atropine, including flushing, mydriasis, tachycardia, and dryness of the mouth, and the dose. So the effects will vary according to the dose of the atropine that is administered. So for example, administering a 0.5 milligram per kilogram dose of atropine will have a slight effect on the heart. There is a slight cardiac slowing, there is dryness of the mouth, and inhibition of sweating. Administration of 10 milligram per kilogram or more of the atropine will show signs of, for example, pulse rapid and weak. There is also blurry vision, the skin flushing, hot and dry cardiac ataxia, and it can also lead to coma and finally death. Uses of the parasympatholytic drugs. So we'll start with atropine. So atropine is of course a pre-anesthetic agent. It is used as a pre-medication before an anesthetic or a general anesthetic. It is also used as an antidote or a reversal agent in organophosphate and carbamate poisoning. So these organophosphate and carbamate are considered to be anticholinesterase drugs. They are also known as anticholinesterase inhibitor drugs or cholinergic agonist drug. They are also used for relief of hives in horses. Again, hives is similar to asthma in humans, and it can also be used for eye examination at an eye drop of 1%. We also have the homatropine. It is a 2 to 5% solution topically in the eye for ophthalmological use as a mydriatic or cycloplegic agent. Glycopyrrolate is another commonly used parasympatholytic drug, and it is also used as a pre-anesthetic together with the same with atropine.